Well, we want to talk COVID now and a new mandate today from the governor regarding vaccines. The state health department requiring all workers at hospitals and congregate care settings to get vaccinated against COVID-19 by Monday, September 27th. That's the date. Healthcare workers have had access to the vaccine longer than anyone. But take a look at the numbers in Western New York specifically. Besides hospital workers in Cattaraugus County, or Chautauqua County, I should say, at least a quarter of hospital and skilled nursing staff in every single part of our region are unvaccinated. Find your county there and look at the rates. We'll show this again in just a minute. Let's discuss with Chief of Infectious Diseases at UB's Medical School, Dr. Thomas Russo. Dr. Russo, it's always great to have you on. Thanks.
Great to be with you, Michael.
So you heard the numbers there. There are still a quarter to a third of these healthcare workers who have not gotten vaccinated. What do you think of this mandate that we're now getting from the state? Is it necessary? And how much do you think something like this is going to help?
Well, I think this is going to help, Michael. This is a critical workforce, and though for the most part vaccination rates are higher than other groups of individuals, as you mentioned, they remain imperfect, and this is a critical workforce to protect, which was the rationale early on when vaccines first became available. Healthcare workers were put to the front of the line because they're needed to take care of patients. And further, by having a fully vaccinated healthcare workforce, this is going to afford significant protection for the individuals that they take care of in hospitals, long-term care setting, and nursing homes.
I think in some cases we've been surprised to see the percentages not even higher among this workforce. So we'll see how all of this plays out. I know you said you're already getting a lot of questions about how this is going to work. But I do want to ask you about one other thing, kind of sticking with vaccines. We want to take a look at this tweet that went viral over the weekend and into today about vaccination rates and severe cases of COVID. So we'll show our viewers the tweet from Dr. Ashish Jha, national expert, focused on the differences in severe cases in states with high vaccination rates versus states with low rates. And we're kind of breaking down the number of people in the hospital and the number of people who died. So this is looking at Tuesday of last week in the 10 worst and the 10 best states for vaccinations. And in the 10 worst states, they're dealing with more than 14,000 people hospitalized, more than 250 deaths. An average of 38% of the people living there were fully vaccinated, very low rates. In the 10 best states, on the other hand, only 1,400 people in the hospital and only 32 deaths. That has around 62% of the population vaccinated when you look at those 10 states. Both groups have about the same number of people, so it really does show us that COVID patients in states with these low vaccination rates have 10 times higher hospitalization rates and are 7 times more likely to die. So I'd like to just get your reaction on all of that. And does this kind of back up the theory out there that there is a direct correlation between the amount of vaccination in a community and how dangerous this virus is in that community?
Absolutely, Michael. Vaccines work, and the main goal of vaccination is to keep people out of hospital and prevent bad outcomes. And these data really support that. Now, I think it's important to add, even though in the higher vaccination states, there's still some hospitalizations and still some deaths. You know, there's work to be done here. And people have to remember that all of these hospitalizations, even in states with higher vaccination rates and deaths, they're preventable. If everyone was vaccinated right now, we wouldn't really be in the position we're in with this huge surge of the Delta variant. So you shouldn't rest on your laurels if you're in a high vaccination state. We still need to go ahead and push vaccinations in that significant minority to drive those hospitalization numbers and deaths down to even lower numbers.
Yeah, and New York is among those states with higher vaccination rates, certainly than the nation as a whole, but we are still not where we want to be. Dr. Thomas Russo, infectious disease expert with UB, also practices at the VA hospital. Thanks so much for sharing your insight with us.
Yeah, always great to be with you, Michael.
And thanks to you, everybody, for watching today's Town Hall. You can text us a question or comment to 716-849-2220. Scott and Kelly are back with Channel 2 News at 6 after a quick break.